The brave Princess of Wales has revealed her cancer diagnosis. She reassured everyone that she is getting better. Catherine, who is 42 years old, had surgery at a London hospital in January. She then returned to Windsor for her recovery. The tests after her surgery showed that she had a type of cancer that doctors couldn't identify. She then started chemotherapy treatment. Even though the diagnosis was a huge shock, Catherine is now in the early stages of preventative chemotherapy treatment. She found out about her cancer a month ago. The palace recently told everyone that Catherine's health has improved a lot in the past month, and she is eager to get back to her duties. A member of Catherine's team, a specialist in chemotherapy, shared that Catherine has faced some tough times recently. Here are some details of the conversations between Catherine and the specialist. Doctors usually use chemotherapy to cure cancer or shrink a tumor before surgery. Chemotherapy is a strong medicine that fights tumors. Catherine got chemotherapy to prevent the cancer from coming back. According to a message she released, Catherine, who is 42, successfully completed this preventative chemotherapy treatment. She started the treatment in late February. At first, everyone thought Catherine's surgery was for a non-cancerous issue, but tests showed that there was cancer. After doctors recommended starting preventative chemotherapy, Catherine said she was in the early stages of the treatment. The goal of preventative chemotherapy is to stop the cancer from returning after the main tumor is removed from the body. Cancer can spread to different parts of the body through a process called metastasis, where cancer cells move from the main tumor to other parts. Sometimes, these new cancers are hard to find, which is why doctors often suggest preventative chemotherapy to get rid of any remaining cancer cells. Preventative chemotherapy is usually given through an 4-drip or pills that travel through the body. Patients can get this treatment at a hospital or at home, depending on the type of chemotherapy. Chemotherapy comes in many different forms, but they all work in similar ways and are absorbed by the bloodstream. These medicines can harm cells, especially fast-growing ones. Chemotherapy is often used to treat cancer because it affects cancer cells more than healthy ones. However, it can also harm other fast-growing cells like those in the skin, bone marrow, hair, and the lining of the digestive tract. This can cause side effects like hair loss, tiredness, easy bruising, a higher risk of infection, diarrhea or constipation, nausea, vomiting, rashes, and other symptoms. Patients often take other medicines to help with these side effects. Princess Catherine has a 3-inch scar on her left cheek from a childhood surgery she had. The scar is from a serious operation, though the exact details are private. Doctors think it may have been caused by a birthmark rather than a tumor. Catherine was hospitalized several times for severe morning sickness while pregnant with her children. She received treatment at King Edward VII's hospital in Marylebone. She dealt with this condition during her pregnancies with Princess Charlotte and Prince Louis. Catherine managed her health issues with relaxation and meditation techniques in 2020. After spending 2 weeks in the hospital recovering, Catherine had a significant abdominal surgery in January. She went back to Windsor to recover after being at the London clinic. Doctors initially thought her condition was not cancerous. She was advised to rest for a few months. Her absence led to unfounded rumors and media attention. Employees at the London clinic tried to get her medical information, which led to an investigation and the dismissal of 3 workers. Princess Catherine shared her cancer diagnosis and her ongoing treatment today. Tests before her abdominal surgery did not show any signs of cancer. However, tests after the surgery revealed the illness to doctors. Catherine mentioned in a video that her doctors recommended preventative chemotherapy. She is focusing on her physical, mental, and spiritual health and is feeling stronger each day. She also acknowledged those affected by cancer. No matter what you're going through, please keep believing. You're not alone. Thank you for watching the video. Please share your thoughts with us.